Doc, can I kneel after a knee replacement? This is one of the most common questions I get from patients considering knee replacement, and for good reason. Whether it's getting down to play with your kids or grandkids, kneeling for prayer, or doing some gardening, kneeling is something many of us take for granted until we can't do it anymore. But here's what might surprise you. You're probably asking the wrong question. What seems like a simple yes or no question is really 3 questions in one. And which version you're asking changes everything. In this video, I'll dive into each one in depth, and by the end you'll understand if kneeling is safe for your knee replacement, what kneeling ability you can expect, and even what you can do if kneeling at first feels impossible. Hi, I'm Dr. George Bounajem, and I'm a Harvard-trained and board-certified orthopedic surgeon who specializes in hip and knee replacements. On top of performing knee replacements, I've also counseled thousands of patients through the recovery after surgery. When patients ask me if they can kneel after knee replacement, they're usually asking one of 3 different questions. The first question is, will kneeling damage my knee replacement? Which is about the safety of the implant itself. The second question is, can I physically get into a kneeling position? Which is about the mechanical ability of the joint. The third question is, will I be able to kneel comfortably? Which is about your functional ability and comfort level. Regarding the safety question, I have good news for you. Multiple studies have confirmed that kneeling does not damage a modern knee replacement. The artificial knee joint is designed to handle the forces that occur during kneeling. Researchers have used imaging called fluoroscopy, which is a continuous X-ray that shows a moving image, to watch exactly what happens inside the knee during kneeling. They've found that the pressure points stay exactly where they're supposed to be, without any abnormal stress on the components. Now, we surgeons do recommend avoiding kneeling while your incision is still healing, since early pressure can cause that incision to split open, and that can be a big problem. But once the incision is healed, studies show that kneeling will not hurt the implant itself, and is safe overall. So if you're worried that kneeling may damage your new knee, you can put that fear to rest. Okay, so kneeling won't damage your implant. But here's the thing, being safe and being able to actually do it are 2 completely different things. Can you physically get into a kneeling position after surgery? Well, to kneel, you typically need to be able to bend your knee to 90 degrees or more. Most people do achieve this level of flexion after knee replacement, especially with proper rehabilitation. But here is what many people don't realize. Kneeling is a whole body activity that requires coordination from many different body parts. For example, the health of your other knee plays a huge role. If you have arthritis or pain in that knee, you may find it difficult to push off that leg while trying to get down or back up. This can make the entire process feel impossible, even if your replaced knee is working perfectly. Muscle strength throughout your body is equally important. Your quadriceps muscles on the front of your thigh need to be strong enough to control your descent into kneeling, and powerful enough to help you get back up. Your glute and core muscles also play crucial roles to maintain balance and stability during the transition. Some patients who struggle with kneeling aren't limited by the knee itself, but by the weakness of the surrounding muscles. This is why a comprehensive approach to rehabilitation is so important. It's not just about getting your knee moving, it's about getting your entire body ready to support activities like kneeling. So, kneeling is safe, and most people can physically do it. But how comfortable is it? Here's where things get complicated. Some studies show that only half of patients say that they can kneel after a knee replacement. But it gets even more interesting. Some studies also show that there's a massive gap between what some patients think they can do and what they can actually do. One study showed that when patients were actually asked to kneel, over 80% were able to do so successfully. So, what's really going on here? Well, there are many factors. In addition to concern about damaging the implant, tenderness at the scar and around the kneecap is very common, especially early on after surgery. It's also normal to have numbness around the incision, and many patients describe an uncomfortable sensation when kneeling on a numb area of skin. But one of the most important factors for comfortable kneeling is your knee's range of motion. When you kneel with your knee bent to only 90 degrees, which is what we call upright kneeling, both your kneecap and the bony area below it share the load. Studies actually show that this position transfers about 97% of your body weight to the front of your knee, creating the highest pressure on the kneecap. However, when you kneel with your knee bent beyond 110 degrees, which is what we call flexed kneeling, the kneecap begins to leave contact with the floor. Body weight is now carried primarily by that bony area below the kneecap. This makes a huge difference in comfort level, and it's the reason why patients who can bend more than 110 degrees have much better kneeling ability. So, what can you actually do about this? Let me give you 4 strategies that have been shown to help patients kneel more comfortably. Of course, wait for your incision to heal and check with your surgeon first before you start to kneel after surgery. The first strategy is education and reassurance. Simply knowing that kneeling is safe and won't damage your implant removes a major psychological barrier. Many patients avoid kneeling not because they can't, but because they're afraid it's unsafe. It's also important to understand that comfortable kneeling takes time. Studies show that the percentage of patients who can kneel increases significantly in the months and even years after surgery. Second is focusing on improving your knee's range of motion. Since the ability to bend past 110 degrees increases kneeling ability, work hard to maximize your range of motion with physical therapy. Studies also show that teaching patients how to kneel and practicing it in therapy can dramatically improve kneeling. Third is gradual desensitization. Start by kneeling on a soft pillow for just a few seconds, then gradually increase the time and the pressure as tolerated. As you transition to the floor, you can begin with half kneeling, where you kneel on the replaced knee while keeping the other foot planted on the floor for support. Fourth, and this is a simple but incredibly effective strategy, use cushions or knee pads. You could use a folded towel or a gardening kneeling pad. Don't look at this as a crutch, but realize that your knee can adapt with time and begin to tolerate harder surfaces with enough training. So here's the bottom line. Kneeling after knee replacement is safe for the implant, physically achievable for most patients, and often more comfortable than people expect, especially with the right approach. The key is giving yourself enough time and using the strategies that we discussed. Don't give up if you feel like you just can't kneel early on in your recovery. Many patients who feel like kneeling is impossible later discover that they can do it with the right guidance and patience. If you're recovering from surgery or considering it in the future, here's my video on how to avoid one of the most common mistakes after knee replacement. If this video helped you, click the like button and share it with someone you think it would help. Stay well, and I'll see you in the next video.